Syntell, have you watched a Dr. Mike video before?
I believe I have stumbled on one or two.
Dr. Mike is one of my favorite YouTubers. I love his videos. And so, very excited to do this. You guys, what's going on? I'm Jaby joined by Syntell.
Hey, what's cracking, baby?
We are watching one health hack from every type of doctor, Dr. Mike's YouTube channel. So if you guys haven't done so already, do me a huge favor. Hit the subscribe button, bell icon, all notifications. Vote this up. Let YouTube know you're enjoying what you're watching. While you're doing all that, subscribe to Syntell. Subscribe to Dr. Mike. Links in the description below. Here we go.
I asked 20 doctors from YouTube to give me one health tip they give their patients as it relates to their medical specialty. This video might actually save your life one day. I'll go first. My name is Dr. Mike. I'm a family medicine doctor, which means I am one of the only specialists qualified to treat most ailments and provide comprehensive health care for people of all ages. One health tip I give my patients is to never stick anything smaller than your elbow in your ear canals. This is because too many people are using—
You know this one? You're not supposed to use Q-tips in your ear.
Oh, yes, I did hear about that.
Tools like Q-tips to pull out earwax, when in reality, they're only packing earwax deeper in and even damaging the skin, potentially leading to an infection.
Hi, my name is Dr. Glockenflecken. I'm an ophthalmologist.
Glockenflecken.
That's a big last name. I'd just say Dr. Glock. That's
Yo,
just too much.
Dr. Glock.
Yeah, exactly. That's a good rapper's name, too. Dr. Glock.
Eyeballs. If you think you've lost a contact lens or an eyelash in your eye, don't worry, it cannot migrate back into your brain. That's something a lot of people worry about. It's most likely just stuck underneath your eyelid. You have tissue layers that prevent things from moving further back.
Hello, my name's Ed Hope. I'm an NHS doctor working over in the UK in the emergency department, or as you may know it as the emergency room. It's super useful for us if you ever end up in the emergency department if you bring a list of your medication and any diagnosis you have and the dates of any significant illness or operations, and be prepared for a long wait, so it's always good to have your phone charger too.
Yeah, next time I'm just like coming in mangled and unconscious. Just gonna have my list of medication, like necessary medications with me.
Good thing I brought my trusty manila folder of all of my medical history.
It might be wise to maybe have a card inside your wallet that has that information.
I hear now, just as an added tip, if you're on iOS and you have the health app on your phone, you can have all of that already in there, and then during emergencies, there's ways that they could pull all the information out. Because your phone, most times, are going to be with you.
That's true.
There's a Syntell tip for you.
I'm Dr. Danielle Jones, known online as Mom and Dr. Jones, and I am an OBGYN physician. That means I specialize in pregnancy and gynecologic problems. Stop throwing out your favorite undies because of period stains. After an initial rinse, grab some powdered meat tenderizer, sprinkle it on the stain, and let it sit for about 30 minutes. Throw it in the wash as usual, and when you take it out, the stain will be gone. Formalin, the active ingredient in most powdered meat tenderizers, is actually a proteolytic enzyme. This means that on the steak, it breaks down proteins to make the cut more tender, but on a blood stain, it breaks down proteins to pull the stain out. It sounds like magic, but it's actually science.
That sounds like a great clip to have for like a horror movie or something of like the serial killer who puts like the meat grinder or whatever she said in the clothes to get rid of the blood. Meat tenderizer. Yeah. I feel like that's a great first date conversation too. Hey, you ever throw out a pair of underwear because of period stains?
And the childish part of me, like, I want to like giggle like the little school kid in the back of the class that's listening to health awareness and stuff. I'm like, meat tenderizer on draws? Like, what you holding up in there? Like, it just, those two don't seem to like connect until you hear her explain it. And you're like, oh yeah, that makes perfect sense. But on its own,
it sounds funny, yeah.
Hi everybody, I'm Dr. Winters, also known as the Dentist on social media, and I am actually a dentist who specialized further to become an orthodontist. And we deal with moving teeth with braces and aligners. Little hack for you, because you've probably been brushing your teeth wrong your entire life. Most people brush their teeth completely flat, side to side.
Yeah, this guy's got some Jack Nicholson eyebrows. You notice that? He's got
wow, no,
like,
I can't unsee it.
Completely flat, side to side like that. What you actually want to do is angle it up at a 45-degree angle and get up underneath the gum tissue as well as the tooth, because some of your teeth hides up underneath the gum tissue and you never clean it. So turn that 45-degree angle, brush your teeth for 2 minutes, and your teeth will be cleaner than they've ever been in your entire life.
I have heard so many variations of how to properly brush your teeth as a child. The small circular motion, the large circular motion, the firm bristles, the soft bristles, the moving up and down. I have no idea how to brush my teeth. I don't even know how to respond to that. Is that the correct way? Are you a 45-degree?
I just feel like some of this is fortune telling and shit. You know, what do they call when they like read the cards and stuff like that and to figure out
tarot card reading?
It's just like, you know, everyone's got an opinion about what this is supposed to be. You know, like perfect example. You know, I got kind of stomach stuff going on when I was in India. It's called Delhi belly is like the commonly known term. I called it Mumbai belly because it happened to me when I was in Mumbai. When I got back to the States, I asked my doctor for antibiotics. But knowing what antibiotics does to your body, while I was at the hospital, I also bought probiotics. And the guy behind the counter was like, you can take this a couple hours after taking your antibiotics. And I was like, that doesn't seem right at all. You're going to take antibiotics again the next day, which is going to kill the probiotics you just took the day before. Why would you? And so then I started asking everybody I knew who was related to the medical field, like what you should do. Nobody had a consistent answer on this. Not one person. The pharmacist at Target, she didn't know either. I mean, well, she knew, but she had her answer too. She's like, I don't know why you would take the probiotic while taking the antibiotic. I would just like run out your prescription first on antibiotics and then take the probiotic. And no one had a consistent answer. And so with the toothbrush thing, like no one's gonna have a consistent, everyone's got their own science to go with this.
My name is Dr. Dana Brems and I'm a podiatrist, which is a foot and ankle surgeon. One crazy foot hack is one of the most effective topical medications you can use for toenail fungus is actually just Vicks Vapor Rub.
What?
It has eucalyptus and menthol, which are both antifungal.
My name is Dr. Anthony Yoon, and I'm a board-certified plastic surgeon. One simple and natural way to plump your lips is to put a drop or two of food-grade peppermint oil into your lip gloss, and then mix it up and then apply the gloss onto your lips. It should create a very mild tingling sensation, and your lips will gently plump up a bit. But if your lips start to burn, then wipe it off, throw it away, and start over again with less peppermint oil.
Hey, my name is Dr. Alok Patel. I'm a pediatrician.
The side effect is burning lips? Oh, the cost of beauty.
Yeah, exactly.
Specifically, a pediatric hospitalist. So I take care of babies, kids, and teens who have been hospitalized for a variety of different reasons. Suck up some snot. For real, it's not that gross. Babies and toddlers tend to have runny noses, a lot of mucus during cold and flu season, which lasts forever, and you can help them out with a nasal aspirator or a nasal suctioning device. It clears their nose, helps them sleep better, eat better, improves their mood, and potentially prevents a problem from getting worse.
Yeah, I thought there was like a squeeze toy. There's like a squeeze thing. You just stick it in their face, and then go, and like you do that, and it'll suck it out.
Yes, that's what most people have used for years. I remember my parents used that on me. We used it on our son.
Yeah, exactly. You siphon out the You siphon out the.
You sit there with your child. You over there like,
yo, son, we gotta siphon this snot out.
Let me drain out Junior real quick.
Golly.
Hello, my name is Dr. Austin Chang, and I'm a gastroenterologist, otherwise known as a GI specialist. One important hack I can offer for the gut is that colorectal cancer, which is the second leading cause of cancer deaths when men and women are combined, is often preventable. We have ways to prevent this cancer, and it's often with a procedure called a colonoscopy, where we can actually take a look inside the colon, find these precancerous growths before they turn into cancer and remove them. And that can actually help prevent cancer from happening.
Do they put you under for that?
Yeah, they do. And I am a huge proponent of, if you are like, especially like you're getting like past the age of 35 and you're a man, there's like this stigma in many communities about going to see a physician. Yo, throw that BS away, go get checked.
Yeah.
Because the earlier, the better. Like, I'm really glad that we're actually doing this video, but just from personal experience and people that I know when it comes to that, when it comes to colon cancer and stuff like that, it's all good. Don't worry about it. I've been checked. Family members that I know, I just want you to know that, there's nothing unmanly about that. Go see that. Go get that done.
I'd say you question your manhood a little bit, but you should still do it. I've had my fair share of experiences. It's a little bit humiliating, but you got to do it.
You have to do it.
Currently, I'm a general surgeon in the NHS. My job has me dealing with basically anything you can find when you rummage around someone's abdomen. One day it could be cutting out bowel cancers, the next day slicing out badly behaved gallbladders. The most underrated life hack for optimized bowel health is probably just eating more fiber. Just increasing your fiber intake by 10 grams of fiber a day reduces your colon cancer risk by 10%. It's not a bad exchange. 10 grams of fiber is a banana and 2 slices of bread. Easy.
My name is Dr. Michael Cellini, and I'm a dual board-certified diagnostic and interventional radiologist. One secret I'd like to let you in on regarding my field of radiology is that we see everything. If you swallowed a chicken bone, we see it. Put something somewhere, we're gonna see that too.
That guy looks like he enjoys his job way too much. that dude made me really uncomfortable.
There used to be like a subreddit. I'm sure it's been taken down by now, but there used to be a subreddit that focused on like things like people that radiologists find in people, odd things. And that's why he's giving you that look, that knowing look, like be careful.
Hey there, my name is Dr. Sanjay Juneja. I am a hemonc specialist, otherwise known as hematology and medical oncology, which specializes in blood disorders and cancer. One of the biggest tips that relates both to hematology and oncology, and it's not very provocative, is that we need to register for bone marrow transplants. People are waiting and hoping and praying that somebody swabs their mouth and sends it in because they have a short amount of time in which they'll live and have control of their cancer, their leukemia or whatever else, and they're just hoping this random person in the United States or Germany or wherever actually is a match that will save their life.
Hey guys, I am Dr. Shireen Idris, a board-certified dermatologist, and I am wearing sunglasses indoors because I just had LASIK eye surgery. One tip that I really think you guys...
I thought the sunglasses was going to be a factor in like some kind of life hack. I'm so excited.
So did I. Sorry. Okay, I'm glad it's not just me. I'm glad it wasn't just me.
have to think hard about, especially when it comes to cosmetics and laser procedures, is the following. Would you go to the dentist and get your teeth cleaned without brushing your teeth every day? The answer is probably no. A solid skincare routine is the anchor to any sort of cosmetic procedure that you get in office.
Hi, I'm Rena Malik, a urologist and pelvic surgeon. That requirement of drinking 8 glasses of water a day is a myth. This was recommended by the U.S. Food and Nutrition Board in 1945. However, it wasn't based on any sort of evidence-based scientific research. And they noted that most of these fluids are found in prepared foods. So unless your doctor tells you otherwise, drink when you're thirsty.
This lady, she's done a lot of videos answering questions that guys have, but they don't really have a place to ask it. You know what I'm saying?
Oh, she does the one-on-one time videos that men have.
I don't know what you're talking about, but yes, probably. Like, yeah. Like, she just answers a lot of questions about like myths. Like, she's a myth buster when it comes to all things like that, and being a urologist. And so, would you date a female urologist?
Only because I would want to know if there's some cheat codes and hacks, body hacks that I could apply. Like, you're the expert, right? And then, if we're like, that kind of relationship, then she can really give me some one-on-one advice.
Admittedly, my insecurities come into play, and I'm just like, I get that there's like nothing sexual in her job, but it's just like kind of weird.
If you are outdoors in hot temperatures or exercising, consider drinking a little bit more. The trick is to look at your urine. If it's a light yellow color like lemonade, that means you're drinking enough. If it's any darker than that, consider drinking a bit more.
Hello, my name is Rohin. I'm a consultant interventional cardiologist from the UK. Every adult should know their blood pressure and their resting heart rate. I'm not saying you should check it obsessively, but I think they can be really useful sources of encouragement if you're embarking on an exercise program. You can track both of them getting better, particularly your resting heart rate coming down in just a few weeks. And that's important because the more you can lower your resting heart rate through exercise, the longer you live. They actually correlate with one another. So if you can, get out there and exercise regularly.
I literally just checked my watch for my resting heart rate, and it is 58 beats per minute. I have no idea if that's good or not.
I say that's good. Mine said 67 beats per minute 5 minutes ago. I think that if it's above 70 or 80, that's
I think then it's a problem.
I think that'd be a concern. But I think everyone's resting heart rate is different.
Yeah.
Mine,
and it depends on your age, too.
Yeah.
Yeah. Age has a big determining factor.
And also, like, I was going to make a terrible joke. There's so many jokes you can't make anymore.
What's crazy is it's like, you know, the easy out is like medical procedures and medical stuff. It's oh my gosh, it's like I could really write some gems on all of these videos if I really wanted to.
Yeah.
JP3, and I'm a board-certified anesthesiologist and a regional anesthesia and acute pain medicine specialist. This tip goes out to all my pregnant patients out there. At the end of the day, it's totally your choice if you want to have epidural as part of your labor plan. But if you do, it can be very difficult to place an epidural in someone who's in labor. You have the baby who's kicking and punching and ready to come out. You have your uterus that's contracting and doing its thing. Then you have mom who's screaming oftentimes, "Where's the anesthesiologist? Get them in the room now. I'm ready for my epidural." And for us, really getting into that position that we need you to get in to allow us to place that epidural and get you more comfortable is extremely, extremely important. We need you to have your head down, your shoulders down, all right? You're gonna be forming the letter C. You're curving your back out towards the anesthesiologist, like almost like, you know, a shrimp or an angry cat. That really allows for those spaces back there between the spinous processes to open up so that we can get that epidural needle in and place that catheter into the epidural space so we can start giving you the medication and getting you comfortable.
Hi, why the f do we need to know that now? Like, what? Why wouldn't you just educate the person in the moment? Maybe they're hysterical from what's going on, and maybe it's good to know that. But I feel like you would know that before everything goes down.
I think, and correct me if I'm wrong, the people assume that at any given time they can get it, but like you said, you get to a point where it's like, it's too difficult for us to do this, and you've passed that moment. Like, you're just gonna have to give this the old-fashioned way now.
Yeah.
So if you wanna avoid it before you get to that point, then I think.
My name is Dr. Antonio Webb. I'm a board-certified orthopedic spine surgeon here in San Antonio, Texas. I know a lot of people have back pain. One tip is to keep your weight down. The more weight that you have being applied to the cushions or to the disc in the spine can lead to degeneration, and that can cause back pain. It's said that each additional pound of extra weight leads to 4 additional pounds of pressure across your disc. So if you have 200 extra pounds of weight, you have about 800 extra pounds of force that has been applied to your spine that can wear down your spine, the disc, cause arthritis, degeneration, and lead to pain.
Yo, did you ever see the Brandon Fraser movie that came out that was critically acclaimed? The Whale. Yeah. Yeah, and you see how he was like trying to get around. Now that I can like associate the 800 pounds of pressure, because he's like 400 pounds over what is a safe limit. Oh my God. I'm surprised his discs didn't literally shoot out of his back when he just got up to even go to the kitchen.
I like the film. I just would never watch it again. This eating scenes just were like too much for me.
Suitor, and I'm a non-surgical sports medicine doctor who focuses on treating orthopedic and musculoskeletal injuries in athletes. If you have a new injury like a sprained ankle where there's a lot of swelling, a good way to help reduce the pain and inflammation is through the use of ice. A great way to do this is to actually take a bag of frozen vegetables like peas or corn and use that to help ice the area. You can throw it back in the freezer when you're done, and it helps to really conform to the joint you're trying to ice. Just don't eat it afterwards.
Hi, everybody.
Why not?
I'm not wasting some peas.
No, that trick I learned from gymnastics, because I would see someone get injured and the guy who was running the place would bring out like a bag of peas. I'm like, that's odd. Why would you do that? It's supposed to like ice. But it's like, it just helps conform to the...
This is Dr. Jessie Gold. I'm a psychiatrist, which means I look at the brain-body connection, or really, I'm a feelings specialist. The tip that I would give is the tip I give myself, which is take time to ask yourself how you're doing. And don't just like do it occasionally, do it every day. It's really important that we give ourselves time to recognize our own feelings and emotions and not judge them. Feelings are not good or bad, they're just feelings, and we need to give ourselves space to acknowledge them and deal with them. Literally everyone can benefit from therapy. I'm well aware that that is a privileged response and access isn't available for everyone, but don't just see therapy as something you do when you have a problem. Think about how it can make you better and look at it from that perspective. I go to therapy every week and I really find benefit to it. It makes me better at my job, it helps me care for patients better, and helps me in all aspects of my life.
Everybody who's watched Sopranos knows therapists see therapists. So Don't have to say that. But I think that her tip in this covers a lot of what you will cover or experience in therapy, which is just like, how are you feeling? Are you making space for those feelings? Feel your feelings and let them go, because you trying to suppress them is not good for you. You got to feel it. Well, that's what you're going to encounter in your therapy sessions a lot. Have you done therapy?
Oh yeah, multiple times. Yeah.
It's just
I highly, if you have access, I highly recommend it. And getting help is getting easier year to year. Is getting easier. People are finding better ways to find access, and you can get access to people that you may be a little bit more comfortable with. If you need just a woman, or if you need just a guy, if you're of whatever religion or faith or sexuality, like there is a therapist that, especially if you live in a larger city, that can fit that comfort zone for you, so you can feel at ease.
Yeah, they have places like I've gone to in the past where they'll ask you what your income is, and then they'll base the cost of your therapy off of that income. So like you can go to counseling places. There's something for you out there. So it being cost prohibitive is no longer as much of an issue in terms of getting therapy.
And if you have a phone with like Skype or any other of the video software devices, you can actually get help through that as well. If you live in like a rural area, you don't have to be in a big city in order to get help.
My name is Dr. Cedric James Franklin Rutland, and I'm a pulmonary critical care specialist, which means I focus on diseases of the lung, and I take care of individuals who are admitted to the intensive care unit.
For a hot second, I thought he was going to say he was a podiatrist because he's got some hot kicks behind him. Yeah, I was like, that's counter. Okay, you kind of threw me for a loop, but I'm back on track with you now. Let's go.
Who are admitted to the intensive care unit. The number one tip that I have for individuals: don't smoke and pay attention to your environment. I know sometimes we can't control where we live, but we can control what we put in our mouths. And if you're putting a cigarette or a vape pen or a marijuana cigarette in your mouth, it is going to cause some degree of inflammation in your lung. I don't care what anybody else tries to tell you. That is 100% true.
Your lungs, you gotta take care of those. Whenever I'm traveling, I'm always looking up whatever the weather is, the air quality specifically, because that, I forgot what it's called, the AQ or AQI or whatever it is.
The air quality index.
Exactly, yeah. If that thing is high, it's affecting you. And it's like you're smoking cigarettes. You gotta really take that into consideration. This place that we have for shooting our videos, I made sure that the space we got was not too close to a freeway. Because they say if you are next to a freeway, your chances of getting cancer go up dramatically. Like, dramatically. And the funniest thing is, in Los Angeles, those are the most sought after places, is the stuff that's right next to a freeway, because it's convenient. And it's like, that convenience is costing you on some level though, because you're inhaling that like all the time. I try to make sure whenever I'm getting a new place to live or a place to set up an office space or whatever, I'm trying to be away from the freeway.
The thing I thought was fascinating too, and from people that I know, he included not just cigarettes and not just vape pens, and for people that that smoke weed, because I know a lot of people within my own circle who think that is somehow some type of pass to keep from your lungs from being damaged, especially if you're a habitual user, if you're like burning every week or every day or every hour. For some people, just realize like it may not have the exact tar residue that's in cigarettes, but you are still inhaling particles that, like you said, cause inflammation in your lungs. Just be leery. Just because it's weed don't mean that you're safe.
I heard the same thing about e-cigarettes too. Like, I heard those can cause damage as well. But there are alternatives if, like, I'm not going to get into that because then we get into an area where YouTube wants to demonetize my video. So we're going to end it there. Y'all, thanks so much for hanging with us. Hopefully you learned something today. Hopefully you enjoyed going on this like journey of discovery with us. Thank you again. I'm Jaby Kuwait. This is...
Hey, it's your boy Syntell.
Peace out.